Hello, I'm Dr. Priyanka Singh. I'm an internist and a member of the medical staff at Penn Medicine Princeton Health. Today, I'm going to discuss some of the health challenges facing millennials, the nearly 73 million people living in the US who were born between 1981 and 1996. From the rapid technological advances of their youth to the Great Recession of their early adulthood, millennials have been at the forefront of major societal shifts. Consequently, this generation is seeing a tangible impact on their health. In fact, studies have shown that millennials have a high occurrence of behavioral health concerns, type 2 diabetes, and early onset colorectal cancer. Specifically, research has shown an association between obesity and an onset of colorectal cancer in women ages 20 to 50. Those with higher body mass index had almost twice the risk of early onset colorectal cancer compared with women whose BMI was around 20. Other known risk factors are high consumption of alcohol, cigarette smoking, sedentary lifestyle, and eating a lot of processed meat and not enough fiber. Millennials came of age alongside Wi-Fi and smartphones. Even as the previous generations adopt and adapt to new technologies, millennials remain the first group of Americans to embrace a digital existence fully, spending an average of 6 hours a day on their smartphones alone. Numerous studies have shown a correlation between social media use and issues with self-esteem and depression. This is especially true for millennials as they are vulnerable to the unrealistic expectations and fear of missing out, also known as FOMO, that many social networking sites evoke. There are also physical concerns associated with staring at a laptop or the smaller screen of a smartphone or tablet for an extended period of time. Overuse can cause neck and back pain as well as eye strain, which can lead to headaches, blurred vision, and irritated eyes. Excessive screen time can also negatively impact sleep cycle. The artificial light of many devices can interrupt the circadian rhythms, making it difficult to fall asleep at night. Moreover, at least one survey found that nearly 80% of the millennials sleep with their phones at their bedside and wake up at least once a night to check them. And though millennials may technically be sleeping for the recommended number of hours, which is 7 to 9, the quality of their sleep is in question. Poor sleep can lead to a myriad of health issues, including increased risk of cardiac disease and diabetes. According to the Health of America report released by Blue Cross and Blue Shield Association, hypertension, high cholesterol, and type 2 diabetes are more prevalent in the millennials than in the Generation X. The report also notes that on average, the decline in their health starts around the age of 27. What's more, millennial women are 20% less healthy than their male counterparts, with major depression, type 2 diabetes, and endocrine conditions being the main concerns. Here are just a few tips for the millennials to maintain health and well-being. Virtual consultations, known as telemedicine performed by an actual doctor, is a reasonable compromise for anyone who prefers Dr. Google to an in-person visit. Set clear boundaries for after-hour work communication. While some occupations may require a flexible approach, it's rare to be expected to be available 24/7. Set smartphones and other light-emitting devices aside at least an hour before bedtime and put notifications on Do Not Disturb during sleep. Schedule a social media detox and unfollow sites that cause negative feelings. Take breaks to get outside, spend time with family and friends, and participate in activities you enjoy. Take advantage of smartphone settings that restrict time spent on apps. Like people of all generations, it's important that millennials eat a healthy diet, exercise, refrain from smoking, find ways to address behavioral health concerns, and limit their alcohol consumption. And as the technology advances, there are more and more smartphone apps such as diet trackers and wearable devices that can track your daily steps, that can help everyone take better care of their health and well-being.